Here we are. So, welcome to ProutSpace. I've been told I'm stepping in for the wonderful Taraka because she had to pull out last minute. I'm Ranadira. And I've been told that this is actually the last ProutSpace of the year. There won't be one in December. So, yeah, it'll set us off till January. So, Dada Daneshananda has dedicated nearly 5 decades to service as a monk and whole-time worker with Ananda Marga. His early years of work took him across North America, the Caribbean, the Southeast Asia, before settling in West Africa in 2000. For the past 25 years, Dada has been fully immersed in immersed community development initiatives in Ghana, Burkina Faso, and Nigeria, where I understand he is right now joining us. His work centers on extending primary healthcare access to remote and underserved rural communities with a strong emphasis on safe motherhood and reproductive health. Through a collaborative, partnership-based approach, Dada and his team have helped build resilient community health systems grounded in PROUT's principles of empowerment, dignity, and local leadership. His experience offers a rare and deeply practical perspective on what long-term, values-driven development can look like on the ground. So, without further ado, Dada Daneshananda, please share your screen, and I can't wait to get into this. So Dada will present for around 45 minutes, and we'll have time after that for questions. So if you have questions during the presentation, if they're kind of big discussion type questions, we'll hold them to the end. If you want a little bit of clarification on something, you can put them into the chat and I'll voice them to Dada, and we'll keep things moving. So thank you very much, and over to you, Dada.
Okay, namaskar, and thank you for the invitation. I'm happy to be here with you this afternoon. So I'm going to present about work that I have been so fortunate to be involved in for the last 25 years in West Africa, Ghana, Burkina Faso, and mostly for the last 16 years in Nigeria. So I will focus on give you a lot of information about the primary healthcare program and also try to put that in the context of key PROUT principles. So let me see to be pushing the right thing here. Yes.
I think if you just
Trying to get my presentation to move here. Just a second. All right. Yeah, now you see. You change the screen now. Yeah. Do you see a map of Africa now?
It's great. It's great. Perfect now.
Lovely.
All right. Yeah, so here is a map of Africa. So we put the context here. I have been working in West Africa. That you can see on the map, Ghana, Burkina Faso, and Nigeria, where I am now. So Nigeria is, the most populous country in Africa. Nobody knows exactly how many people live in Nigeria. They're trying to have a new census this year, or next year. But the last count we saw was 223 million. But probably there are more. So I am in Ebonyi State. It's one of the smaller states, but it has 4.3 million. And you saw it here. I'm pointing to it on this map. It is in the southeast. It's in the area. Those of us who are getting old, we can remember the Biafra War, which was a war of independence, where the southeast part of Nigeria tried to separate from the Nigerian Federation. So here is Ebonyi State, and it shows. You cannot see it so clearly, but you can see the different places where AMERT has worked on primary healthcare or set up primary healthcare centers. So when we talk about PROUT, it's very, very big ideas. Sadvipra Samaj, we're gonna attempt to put an end to capitalism and communism. We're talking about world government and fundamentally changing the economic system of the planet, and introduce limits on ownership and political reform. So this is like the big ideas of PROUT. Now, we often think that to change the society, we have to go from the top to the bottom. But I'm going to try to, what I have to present is to show how we can take like a micro view of PROUT, see how key PROUT principles can be applied in local community work. So I will tie the work we have done in West Africa into a few key of the tenets of PROUT. One is to guarantee the minimum necessities of life and increase the living standard. So in PROUT, we talk about the 5 basic needs that everyone has. That means food, clothing, medical care, shelter, and education. So we are addressing these minimum needs, particularly then in the project that we have been working on here, healthcare. Another very important thing is moral leadership, good leadership, dynamic leadership. And very fundamental in PROUT is create self-reliance and sustainable development and decentralized economics and decentralized planning. And PROUT must be practical. So, sometimes PROUT, we know it on the sort of intellectual or theoretical level, and we sit and discuss it, the philosophy. Now, when you come to African village, then they are less interested in the philosophy and the theory, and they are more interested in, what are the practical solutions that can improve the lives of the population. So, here in Amert, Nigeria, we have 2 slogans that we use. The first one is called "Making Primary Healthcare Work." So it's a development model, and the components on this model is sustainability, partnerships, community participation, very strong financial management, and strengthening the grassroots level, and reduce dependency, and of course, quality of care. So these are the key aspects of making primary healthcare work. And they are not present in most of the places in the rural areas. You don't see any of these things taken into consideration. The healthcare that reaches the rural population is very, very poor. Our other slogan is "Every Life Counts," which we've been using for our campaigns. And we have it on our T-shirts, and we sort of remind ourselves all the time. So it's not only about these great ideas of sustainability and development, but it's also about saving lives, because we are in a part of the world where a lot of women die in childbirth, a lot of newborns don't make it, a lot of children die before they're 5 for preventable reasons. And so we don't only do this project work, we also do, we can say, humanitarian work. It's almost like when you work in such an area, it's almost like a disaster intervention, like you go to a place where there's famine or where there is earthquake. You're just trying to save lives. Aspects of this is our ambulance service, following up serious cases, financial assistance, and pediatric surgeries, helping children, and also women, mothers, widows with disabilities. So this is like our, shall we say, humanitarian outreach. So I will not go deeply into this thing, but a little bit about how did we start the project, or what is necessary if you want to start a new development project, a new community project in a country. You have to organize yourself with legal registration. You have to look for funding. You need a team, and no one can come in and do something by themselves. and then look for partners, because together we can achieve much more than we can do independently. Sometimes we say, well, we want to maintain the purity of only doing Amart work and Andamarga work or PROUT work, but Baba has spoken many times about the importance of working with all moralists and all righteous people. So for us, we always started very, very small, very, very locally, and the vision expanded as we go along. So when you are working for this kind of community work, you have to look at where you're going to start. You cannot work in the whole country. You cannot even work in the whole province or a whole local area. You have to decide where to go. So the assessment, the time to decide where you're going to put your energy is well spent. So it's our experience that as much as possible, it's better to go a place where the community is looking for assistance or looking for partners. That means that the community themselves are aware of their needs, and they also have the leadership to take steps, to attract other people like partners to come in and work with them. So it's not a good idea to just sort of knock on the door and say, can we give you a school? Can we give you a water project? Can we put up a hospital? It's not a good idea. In such cases, they will all say, sure, we'll take it. The best thing is to look for places where the local leadership already, the population are already know what is their priority, what is their felt need. So when you start a place, it's important to coordinate with government and authorities, and they can also help you to direct you to the right places sometimes. Very important to consider the project area. We should define the area that we are going to work. This can be defined by geographical or cultural or language, different kind of factors. But it's good that, if we want to start something, we cannot, we have to limit and define the size of the area and the population that is our target that we're going to work with. And our decisions will also depend on, what is available. Sometimes you can work with existing structures and buildings, and you can also look at, who do you have on your team, what experience you have. Like when we came to Nigeria, we weren't sure what to do, but we came with experience about maternal health. And so we decided that's one of the key factors that made us go into community health and maternal health. So let me tell a little bit more about the primary healthcare, how we started. We reviewed government statistics, and we also held community meetings to get their experience. And then some of the key factors we were looking at is the closest, because we were in health, what is the closest accessible health center that is functioning? And we also looked at mortality, particularly maternal mortality. Like we will go to villages and we'll sit in a meeting and we ask if they had any maternal deaths. And if they do, and they often do, or most of the time they do, then we will verify them. We will find out, how recent, how many. And if there are many women who have died in the last months or last years, then we know that this is a prospective area, that we can consider to intervene in. And also facility versus home delivery is an important thing to get clear. I mean, where are the women giving birth now? Are they all giving birth at home, or are they giving birth? Do they go a long distance to give birth? in an area with high maternal mortality, we always want to encourage facility delivery. And also, where do the women go for antenatal care? How many of them do attend antenatal care? Other issues are important: acceptance and knowledge, awareness of family planning, other issues locally. So, in my experience, local leadership is the single most important factor for a successful project. So to see what Baba says about leadership, he said the solidarity and unity of a group depends on the strength and determination of the leadership. If the leadership is not strong, the entire structure, social, economic, and political, becomes weak and ultimately crumbles down. Also, Baba talked about, he says people follow leaders, good or bad. I mean, it's the nature of people. So the nature of human beings is somehow like that of sheep. When one sheep goes into the ditch, the others will follow. Human beings are also like that. So we want to find out good leadership and it's a very big factor in selecting the community that you're going to work in, that you find some good local leadership. If you don't find it, even though you determine that there's a very serious need, even though you have good ideas and you might have funding, if you cannot identify local leadership, it's not going to turn out well. So the time has to we have to spend time in the prospective project area and see whether leadership emerges. We have also done mistakes like that. I mean, we see here they really need it, and we have a very good idea. We have funding to start this project, and if we go ahead without identifying local leaders, it's an uphill battle. It will be very difficult. It can spoil the whole project and doom the whole project, or at best it will at least slow it down. When I was in Ghana, Divinishta was there. We worked with Kekeli women, and we have continued the same here. Kekeli is like a Ghanaian word that means like light, like sort of spiritual light of knowledge, and they are like health promoters. And once we asked them, we had a meeting with them, and they will write down what are the qualities of a leader. And this list is in the order of the one that got most votes or was mentioned by most women. So you see humility, trust, all these things were what community women in a Ghanaian village, or from many Ghanaian villages, said that this is what they're looking for as so leadership again is more important than the technology you have. It's more important even than your good plan. It's more important than money, even your good intentions. I can't stress this enough based on my experience that your project is going to be successful to the extent that you can identify local leadership. So who are the leaders? Are they just born leaders? Or are they created? How do they emerge? And how do they grow? So in my experience is that if you move around and you're looking for leaders, you'll find them. They're like jewels. And the project that you start, which can be promoting the ideas and principles of PROUT, you will see new leadership emerge. So it's not only if you have good government people or good headmen or chieftain or chiefs and rich families and so on. I think the best project is where you're able to get to the grassroots, and you will find new leadership, fresh leadership will emerge that you have the opportunity to guide. So the development projects provide some opportunity for the good people to come forward and be a vehicle for new. It's a vehicle for new leaders to express themselves and fulfill their potential. So this I'm just already said all these things. So, but it's important that we are ready to listen, so that the leaders are not just people who will come and listen to us, but also people that will grow to guide and guide the projects, so that they will be the. We must not try to hold on to control and power all the time. We must be able to listen and allow these people to really drive the project forward. So Baba has talked about this thing about the importance of starting in the grassroots. Now I can't even see all these things because of it. Just a second. So to develop, and this is from Baba's writings when he started the Samaj. To develop an area economically, planning must start at the grassroots level. The direction of economic development should be from the bottom to the top, not from the top to the bottom. The latter approach is impractical and an utopian myth. And this is very important to be aware of. Otherwise, we think we are so experienced, we have read such good books, we know how to do things, and we will like, and it's very common in the NGO world and in the international agencies that you have a model that is defined and you carry it, you know, from New York or from Geneva or from your international headquarters, and you carry it and then you sort of impose it on a local in a certain community. So it's important, I think, that these principles. It's good to have our principles, but we must allow, you know, the model and the format of the project to emerge based on what we see on the ground. That means it will be influenced by the reality on the ground. So local participation in the plan. Economic plans and programs should never be imposed from the top. On the contrary, there must be adequate scope for them to emerge from the grassroots. Each and every economic plan should be prepared in the concerned local area. So it talks about the economic plan, but I think the same thing is true for educational projects, for health projects, for water projects, for cooperative projects. And then it's also get the chance to be a chance for the local input to influence how we do things. There are many benefits to block level planning. Some of these benefits include the following. It's small enough for the planners to understand all the major and minor problems of the areas, and local leadership can come forward to solve the problems according to their own priorities. Planning will be more practical and effective, and it will give quick positive results. So this is a key. That means that when we start a project, we shouldn't select too big of an area. For it to be successful, it should be small enough so that the local participants can really understand and really know and really be able to present the priorities as felt by the local population. Because we may think we know what is more important, while even though we intellectually we think we know what is the felt need of the local people is something else. And it's good we need to consult the men, the women, and the youth in this. Sometimes if you go to a community, you will see that the women will talk about the importance of healthcare. The men will talk about the road and the market, and the youth maybe concentrating on education. I mean, we must bring people together so that there's a consensus in the community that what we are trying to achieve, about what we are trying to achieve. So these are some photos from Ghana where we were really very successful in involving the communities. And we can say the key was through having good leadership, and we were able to mobilize the communities, in a very big water project that served or still serving so many villages, more than 30 villages, and more than 30,000 people getting water. So a lot of it was based on communal labor. And I mean, this is a funny story. We were building a water tower on top of a mountain, and the concrete structure needed gravel or stone chippings. So we thought we can ask the local people to do it, and we bought them hammers. And then because it's very difficult to carry the the rocks, the gravel to the top of the mountain, and so they came up there and they broke the stones from the top of the mountain. Later on, they found out that they can sell this thing. So like a lot of the local people got into the business of breaking rocks, sort of as like I mean, it wasn't our plan, but it was like a side benefit or side result of the water project, like a livelihood project sort of emerged inadvertently. So it was a joy to work with the community when both men and women and also the youth were easily mobilized to participate. They were digging trenches, and they carry the pipes and then bury the pipes. Here the women are covering the pipes that have been laid. They're carrying stones to somewhere else. So when we're doing a community assessment, understanding the local culture, it takes time. Like in Africa, is very, shall we say, tribal sentiments, language sentiments, and even clan sentiments are very, very important, very, very critical. And so when you go into a new community, you cannot get it right away. It will take you weeks or months, maybe even years, to really understand how the people think. So, but we have to understand the culture. We have to meet the traditional leaders, like here in West Africa or in Nigeria, where in the Igbo land where I work, the communities have traditional leaders that are called Royal Highness. They're not just chief or headman or chairman. They are considered like kings. And so you have to meet with them because historically, traditionally, they are important. And many of them are good because in this area, there is no dynasties. They're all selected by the leadership. There's no father to son or mother to daughter succession here, which is good. So as I already mentioned before, it's good to follow applications or invitations and identify who are the current leaders. Understand local disputes. Sometimes you walk into a situation and you find yourself in the middle of village politics and land issues and so on. It's very common here in West Africa to understand these things. And of course, security issues. Security is a big issue in Nigeria, with violence and local conflicts, kidnappings, and so on. And land and ownership issues. African Nigerian villagers, they don't joke about land. Land ownership is very, very critical. So as we are making the decisions, the demonstration of commitment is very important. That means we will not quickly promise to doing this or doing a project for them, like for example a hospital. We will require them to demonstrate their commitment, which is beyond just words and promises. So that can be, for us, it can be like, for example, committing labor for construction, and even sand, gravel, wood, land for construction, all those things. So it's very important that to know that only the local people can really know their own needs. And we will never try to impose a project on any community. We'll make sure that they really want it. So for our primary healthcare projects that I've been working with the last years, or since I came to Nigeria, West Africa, but particularly in Nigeria, we've talked on primary healthcare with focus on safe motherhood, because we're in an area with very high maternal mortality. And the pregnant women and newborns are the most vulnerable in society. So it's natural that they become the focus of our work. I think I will not go through. This is sort of like I will just skip these things now before time. But these are some of the key components of our model for primary healthcare. I'll just to the highlight headlines here. Sustainability, yeah, help people to become self-reliant, and creating confidence, community confidence. So in all those projects where we work, we have guaranteed that there must be 24-hour service from the beginning, because otherwise women don't have confidence to come there if they think they might meet the padlock door. And then identifying women at risk. That means antenatal care. That means the antenatal checkup must be done very carefully, because a lot of the women who die, they have factors that can be identified. And if they're identified in time and followed up, it will save lives. So ambulances and qualified staff like midwives is important. And then mobilizing the communities, and also health education. So these are some of the key components. I think it's already what I said in the last slide. One of our special things is that is not common here, but that we have highlighted is to look for local staff, to recruit local staff to work in the clinic. That means people who know the area and who speak the dialect, and who sort of have a commitment to the area because they are their own people. So this is, I think, one of the secrets for whatever success we have had. 24 hours care. I will just go through this a little quickly, but it's a fundamental thing in primary healthcare, and particularly maternal health. You can't, and it's very common in Nigeria here that most of these health centers, there's nobody, they just come from 9 to 5 or 8 to 4. There's nobody there at night, there's nobody there on weekends, no one on holidays. And you know, the babies, they come, actually more come at night than during the day, and they don't keep to office hours, you know, with births. So it's very fundamental. Facility delivery versus home care, home delivery, it's very important. I mean, there's wonderful, wonderful women who are, here they call it village midwives, or in Nigeria, they usually say traditional birth attendants. These are women who help their sisters when there is no hospital and no clinic available. And many of them, most of them are really, really wonderful. They are very impressive personalities, but and they can do natural, sort of normal births very, very well. But when their emergency comes, you know, they are not equipped or trained to how to deal with it very well. In the beginning, to attract people and get them used to come to the health centers, we offered free delivery and free materials, so that because when they, for generations, they have given birth at home, to get them to come to the clinic, it takes some time to get them to come. So antenatal care, we try to do in most of the rural health centers. They are just come, and there's no real much investigations. Like there's no doctors, there's no midwives, there's no laboratory, there's no ultrasound. So mostly they will just come for and talk to a less qualified health worker for some consultation, and they get some routine drugs like multivitamins and iron supplements and so on. But in the places we start that we have started, then they have availability of all these other things to bring better quality antenatal care to identify women at high risk in time. So to raise awareness, we have to go into all other villages and village meetings, women's meetings, youth meetings, and just to raise awareness not only about the advantages of giving birth at the health center, but also about family planning, about hygiene, malaria prevention, nutrition, so many things. Health education is very key. Family planning, and in some of the areas we worked, we actually saw communities where they never heard of family planning. I mean, they never heard of contraceptives. They don't know anything about it. So to create like awareness and acceptance and then have access, it can make a big difference. And it can reduce the birth rates because a lot of the women have 7, 8, 9 children, and they are sort of forced by the culture to have more children even after they are already tired. And so we are using, like one of the slogans is that don't have children you can't train. That means this is something that they can understand, that when they have too many children, they can't afford financially to send them all to school. And the children can become a burden to them. And all the family planning commodities are made free through those health centers. So as local staff, I already mentioned this thing. And a part of that, we also have a program here of scholarships. That means we take volunteers in the health centers, and those most talented, most dedicated, after 3 years, they can compete for scholarship. And we have given scholarship to, I think, 55 local village youth. I think 53 women and 3 men have gotten this thing. And it's a very nice part of the program here to give an opportunity for a career. That means a scholarship, they'll become qualified health workers, and then they can get employment, and they can also come back and serve their communities. So to have good midwives is important for this kind of program. And here's one of our best midwives, Oguchukwu. You can see her; she's working very hard. We found out that we identified after some years, by 2017, I mean, we started in Nigeria in 2010, we identified like gaps. And one of the gaps was emergency obstetric care, like when women have serious complications and they needed interventions like cesarean section or other things like that. There was no access. It was like too far, and there's no transport. And often when you have an obstetric emergency, then delays is what's going to kill the woman and the baby. So in 2017, we started working with emergency obstetric services. So that means we put operating theaters in some of the health centers and resident doctors, so that they could really reduce the delay and increase the access to emergency care. I already mentioned the Kekli women in Ghana. We carried this program also to Nigeria. So we have in 1 or 2 women for every village in all our project areas. And what they do is that they monitor all the pregnancies in the health centers and encourage the women to go for antenatal checkups. checkups during pregnancy, and also to give birth at the health centers. And then those who don't give birth at the health center, they also monitor, how the delivery goes, how many, and so on. And they played a key role in raising the awareness about family planning. And they also organize pregnant women support group meetings. So once a month, the pregnant women will meet with the health promoter and someone from the health center, one of the health workers from the health centers, to learn and to share and to prepare for the birth. Those women who are identified as having high risk that need special care, to ensure that do the best we can to see that she can give birth safely. We have we have health workers who go out to visit that. One of the most important programs these days is our adolescent sexual and reproductive health program, and it's to reduce teenage pregnancy. And we create peer educators in secondary schools that are given lessons and then who pass it on to their mates in school. And we also have people in the villages, like youth, what we call youth champions, that carry messages to not only to the schools but to the villages. And then we have new mothers clubs. A lot of teenage girls become pregnant and then they have to drop out of school, and then they lose their and very often the father is nowhere to be seen. They refuse to take responsibility, so they need support, they need counseling, they need help with their health care for themselves and then their babies. And also we try to instill like ambition and self-esteem in them, so that for them to return to school so that they can finish their schooling. And also we support some to learn a trade so that they can support themselves and their babies. And this year we've put a lot of energy into fighting harmful traditional practices like female genital mutilation, which has gone down a lot even since we started here. But they continue in the remote rural areas, and that's where we work. Like our project areas are in remote areas. Also child marriage, women, small girls are married off, to reduce the debt or to pay to do a favor, from the father. And there is still a lot of violence here. Like it's a very male-dominated society, and traditionally the men feel like, there's like a dowry here. They pay a bride price, so then they feel that the wife is their property. They own the property and they can do whatever they want. The violence and also economic suppression of the women. Like some of the women who make some money, the men will take the money from them while at the same time demanding that she will feed them. Another nice program we have done is health rallies. That's sort of like a festival, like a whole day program where we mix cultural displays, dance, music, song, with dialogue and health talks and things like what they call here the masquerade. Is a tradition here where they dress up in elaborate costumes and masks and so on. So it's very, very nice. You can get hundreds of people in the village to come, and everyone from children to the old people enjoy it. And in the process also there's dialogue about and presentation about health issues. So going back to some of the PROUT principles, it's in PROUT, it's emphasized to strengthen the grassroots. And when it comes to health centers, it is important to strengthen the health facilities financially. And so we put a lot of effort into this to involve the community and the management and to make them feel responsible, make them feel comfortable, no ownership about for the health center. So these health centers is sort of unique. I mean, formally they are government health centers, but they're community owned. And then of course, AMART as a partner is a key factor also. But for sustainability, we're trying to strengthen the community and the financial management. So and the Management Health Center Finance Committee is composed mostly of health workers and some of the community people. And so they do manage all the finances, and it's them who are the signatories on the account. Like Amart has no access to, I mean, we are not signers on any bank account, and we don't carry any money from the health centers. Actually, when we started off, we made an MOU, one with the government and one with the community, and both of them say that all the finances of the health center will remain in the health center. Government will not carry any money, AMART will not carry any money, even community will not carry the money for something other than health. So this has been very, very important. So the health centers have been able to contribute towards expansion, construction. When there is leaks in the roof or some equipment breaks down, they have money to repair it and so on. So this is in one way, I mean, we can talk about saving lives and surgeries and this and that, how many deliveries, but in one way, it's one of the achievements, or maybe the achievement that we are most special, most unique, because it's so different here. Here, everybody, most of the people are really, really poor, and everybody feels that it's their right to put some money in their own pocket. So to stop these kind of leakages and to create like a unity where people together work to strengthen the health center, through good financial management is very, very important. So we monitor every month. They all have computers, all the accounts are computerized. And we review them every month and try to, I mean, there's always challenges or difficulties or weaknesses, but it has made them having money in the bank and made them ready to also employ additional staff and do a lot. So the keys. So I think I already mentioned these things. I'm just repeating myself with this slides. So the AMART and moral leadership. I mean, this is very important here. It's not so easy to get everyone to do meditation and yoga, but I think the key moral principles that we are teaching less through lectures, but more through an example. That means instilling that service spirit. That means always ready to go the extra mile for the patients, making every effort to save lives, and having transparency in all financial matters, accountability, and we create this culture of integrity, where there is no corruption, and we're trying to then, through example, overcome, the materialism, the greed that is so dominating in our society, not only in Western world, but even into the African village. People are materialistic and are looking out for their own financial benefits and so on. So this idealism is very important. So back to I think I have to say much more about it. You see some photos here of ambulance service. We have 8 ambulances, and they all have drivers. And we subsidize it to some extent, the ambulance service, and you can see surgeries going on in the villages. And the other picture here is from cholera outbreaks. So we have we're able to respond whenever there's a disaster like that, like a like cholera outbreak or even flooding, or even when there's displaced people due to communal conflicts and so on. So these are some of the aspects here of, shall we say, the humanitarian work we do. So since we started, we have 32,000, we're getting close to 33,000 babies born. And this is without counting twins as two or triplets as three. This area is the part of the world with the highest rate of multiple births, twins and triplets. Even quadruplets, I've seen a couple. So we have done 2,000 cesarean sections now in those health centers, more than 4,000 ambulance runs. And in some of the areas, we have achieved up to 95% health center delivery, health center birth, and which is a very great achievement. And this is actually real figures, because when government produces statistics of health center births compared to home births, they are just guessing. But in our project area, we actually track all the home births. So in the beginning, in one health center, if we had like 30 births, we congratulated ourselves, but we didn't know whether it was 30 out of 40 or 30 out of 50 or 30 out of 100. But since 2014 or 15, when we really put the maternal health promoter system structure up, like this grassroots structure of health promoters, then we are actually tracking this very well, so we can know a real impact. So 4 places where we do obstetric referral centers. We have put up 25 health center buildings, and in all these buildings, the community, either in the initial stages, the community provided the labor, or in later stages, the health center savings paid for all labor. Of course, Ahmed brought some, construction materials and so on, but a significant community contribution to construction. So we got an employment for a lot of health workers, up to 160, if you count all in all the health centers. And we have sponsored a lot of children's surgeries. Even we have taken surgeons to the villages to have minor surgeries in the villages, and then more major surgeries in the tertiary hospital here. We have sponsored life-saving surgeries. And we also do water projects. So in boreholes, we have reached more than 280 villages. Economic empowerment is like a cooperative model for widows and women who are the sole breadwinners in their families. We have reached more than 1,000. Just last month, we passed 1,000. And as I already mentioned, scholarships for health is about 53, or maybe it's 54. I'm not sure. So when Ahmed comes in, I mean, traditionally we will put a signboard, and sometimes the way we think, unless we have like a signboard on it, it's like useless because we won't get the credit. But here we do have Ahmed sign on. We have T-shirts. A lot of the people who work with us are carrying T-shirts with Ahmed or Amartel, and but on the health centers, we just have like a very small sign where it says Ahmed assisted. So we don't claim any. We have no leadership, and we don't have any ownership, and we don't claim any ownership. So if we rather promote the local leadership and local ownership for the sake of the long-term sustainability of the program, that is better. So we are here for the all-round welfare of all. So we're talking about the community. So this is something I have already mentioned before. We require the communities to demonstrate their commitment from the start. So self-reliance, if the project can sustain itself economically, it's not a development project. I mean, you hear stories of organizations putting up big hospitals and then reducing, improving all the indicators in health. And then they, for some reason, they cannot sustain it anymore. And then within a very short time, all the indicators will go back to what it was before. So that means whatever we did nothing for development. So that's why we give emphasis on sustainability, economic self-sufficiency. So Baba says this, society has a responsibility to meet the minimum requirements for every individual. But if it arranges food and builds a house for everyone under the impetus of this responsibility, individual initiative is retarded. People will gradually become lethargic. So we are not supposed to, it is not wise to just give people everything on a silver platter. We require a commitment, and we want to structure it so that it can carry on, help people to help themselves, help the communities to, so that the projects can stand on its own legs. So avoiding dependency. So help communities to overcome inferiority complex and a feeling of helplessness. Never build dependence on outside funds. As far as possible, get work done by communal labor and instill pride and sense of accomplishment. But it's very, very important people to take pride in the achievement, so that when we do a project, a successful project, it's not only that Amert is feeling proud, but more importantly, is that the local community should feel proud in their achievement. They should feel that they did something for themselves, and they should feel the ownership. So too much money too fast can be detriment to genuine community development. That's why it's better to start slow, start small, and let it take time to grow in an organic or natural way, and let the community be part of facing the struggle. So, from a Western point of view of efficiency, we make timetables and set deadline. We have to, like in African village, in the traditional societies, they are not bound by clock and calendar. And, we can say for the sake of productivity and efficiency, we have to push, but it's also something to learn. We can take a lesson from the communities who has a lot of patience, and to allow them to be carried along and to drive the things forward themselves by their own effort. In the long term, it will give better results. So what are the criteria for success for this kind of project? Is that the project continues without outside funding. That means that we withdraw funding completely, gradually, but when we can withdraw funding completely, when it's a success, when we can walk away from the project. Or the key thing is that the community will continue to benefit after we move on. So that, of course, involves local management. Local leadership must be real. And the community can also then be inspired to take up other initiatives if the confidence they gain by being successful in one project can inspire them or give them the confidence to start something more. And then the way we did it can be replicated by others. So PROUT must be applied in a practical way. When theoreticians expound the theory, they do not study the world to ascertain its practical application. Blind to what is underneath their feet and with the total disregard for reality, they build castles in the sky. This is what Baba has said, and it can be a warning to us. I mean, in PROUT, very often most of the focus is on, theory and ideas, and if we're not careful, we'll be spending our time building castles in the sky. So it's good to come down to the grassroots and to undertake projects that where we work closely with the people. And that means that what I've tried to explain here, how PROUT is key tenets of PROUT is applied to something very, very practical, something that directly affects the quality of life of the population. The entire wealth of the universe is the common patrimony of all, so the minimum requirement of life should be made available to everybody. In other words, food, clothing, medical treatment, housing, education must be provided to all. So this is like the really practical things. Sometimes we get lost in the models of government and economic theories and so on, but every man, woman, and child needs the minimum necessities of life. And so it's good when we are doing community projects that we make it as practical, as concrete as possible. Our mission is to unite the moralists and work with those who want to serve selflessly to help people in times of calamity and distress, provide both extensive service and intensive service. Seek to elevate the standard of living to the common people. So here I am at the last slide.
Okay.
Yeah, I know you. I heard your voice. So it's our last line, which is a message to all of us. Be concerned with, from Baba, be concerned with others' necessities, particularly those of you who are in responsible positions of leadership. Remember that you should never think no one is bothering to inquire whether I have eaten or not. Rather, you should always be concerned with others' necessities, not your own. You should always think more about your duties and responsibilities than your rights. So that's it. I mean, this is just a summary of what we talked about. So thank you. I talked a lot. Have I gone over 45 minutes?
You spoke for an hour and I enjoyed every minute. Thank you so much.
Okay, I'm sorry. I didn't really have a watch in front of me.
No, that was perfect. You went perfectly to the hour. I was just gonna let you know that it had been an hour. So yeah.
All right.
I'm just gonna stop your sharing then and I'll just quickly put up some details here so people can. I'll just leave this up for a moment so everyone knows how they can see more about the project. But yeah, wow, thank you so much, Dada. That was really transformative work. I mean, healthcare, education, economy, leadership, it just touches on so many things, and it really seems like we're starting from a very difficult baseline and just seeing all those pictures of the local people being involved and really transforming their own communities is very, very inspiring. Like really, really fantastic work there. So I just want to kick things off with the you said one of the measures the of a successful project is that other communities and other projects are kind of taking note and being inspired by this and doing this kind of thing themselves. Have you noticed that?
Yes, I think we've gotten quite a lot of attention from international partners or NGOs because the model that I described here for primary healthcare is sort of emerged here. We didn't come with like I mean we had some ideas like 24-hour service and of course the basic thing of working with the community and the community ownership and so on. But some of the specifics of how we do things we can say it is emerged from this part of from Nigeria, or not only from this part of Nigeria, but from the rural communities here. And I think the USAID, of course, now USAID is gone, but there used to be a lot of USAID organizations here working in health and implementers, and they were really interested in how we were doing things. And there was one USAID program called IHP, Integrated Health Project. That's the name of it. And when they finished after 4 years, they supported or assisted and trained and more than 220 health facilities in Ebony State. And when they did the report at the end of the year, at the end of 4 years, we found out that in terms of like facility deliveries, that means number of babies born in those in the places where they worked, uh, more than 25% of the births were from the places where AMERT has assisted. So that means 10 health facilities provided 30% of the births of 220 facilities. So they were very happy, and when they left, they also gave us a lot of equipment. They gave us a very nice vehicle and some other things. Instead of giving it to the government, they gave it to to us to continue the work.
Wow, that is really, really impressive. Just to illustrate that. So we had a question from Didi Devanishta. I don't know if you want to speak the question yourself, Didi, or I can read it out otherwise. Okay, so Didi asked, can you tell us why you chose to work with women and childbirth? Well, Didi's
Why-
got, is that right? I see you've come online now.
Yeah. Sorry, I was walking out I'm out to take the compost out with my speaker in my hand, listening to everything, and then I had to dash in to answer. I I just um I know that I've chosen to work with women in my work, and I just wondered why you have chosen what you did and how what are some of the profound effects you find from working with women?
Yeah, that's it. Well, it really started in Burkina Faso. I came to Ghana in 2000, and I already the same year in 2000 I visited our project area in northern Burkina Faso, Deo, and the government gave us a proposal to asked us if we can help them to train village midwives in remote areas. And here we're talking really remote, the border area between Burkina Faso and Mali, places where they never seen vehicles, they never seen white people, where they live in grass huts. I mean, it's the most exotic experiences I had in my life working there. So we decided to take up that project, and that's the first time in my life that I started working with like maternal health, and we identified the village midwives, and we brought trainers, and we give equipment, and so on. So that's how it started. Then later on, we started also the Seva clinic in Ghana, and then you also visited there. Maybe you met Kekeli women and all those projects there. So coming to Nigeria, when we were invited, to come here, and when we had to decide where to work and what to do, because we had the experience of maternal health, that was also what brought us to Ebony State, because Ebony State at the time had a maternal mortality rate of more than 1,000. I mean, it's like one in 100 women die, there's one maternal death for every 100 births. And so as the project developed, almost everything we do is for women. It is, this safe motherhood is the focus. And then later on, when we did the scholarships, it's, as I said, I think it's like 53 for young women, only 3 for men. And then also the economic empowerment was for the widows and women who are the sole breadwinners in their families. And now also the adolescent sexual and reproductive health program, which is like one of our biggest activities now, is focused on the health and rights of the girl child. It feels very natural. So it's natural because they in the village, when you look at health, the mothers, the pregnant women are the most vulnerable, and traditionally, the women have been really suppressed here, through the systems of inheritance and the sort of male dominant society. If you want to do development work in a Nigerian village in this area, it is just obvious that it will lead you to work with women. So I'm feeling very comfortable with it. I have some great women working with us. We had support from Amartel in the US and in Germany and some other countries. And now also the last years, all those programs, a lot of those programs are done under Amartel banner or with Amartel t-shirts, and the women who work with us here are also feeling that they are working with Amartel. So I'm feeling, I never have any problems with it.
Right.
I'm comfortable
I,
with it.
I find that when women are pregnant and becoming mothers, they change. They're so open to change, so open to learning things. So, and women do so much to bring information back to their families that if you teach women about health, like you were doing in Ghana, and I joined you for a short time there, that it spreads to the whole village, it spreads to the whole family in a way it doesn't if you're working with men in the same kind of way or teaching them in the same kind of way. So I loved your model there where you had the women elect someone from their community to come to monthly health education workshops at the clinics and bring that information back and implement it in their villages.
It's very nice. It's also nice to see the women assume leadership. Like when we do these health rallies and even other health education meetings, those women, the health promoters, they put on like dramas, and sometimes they will like play the man. They can show the man refusing to help with the school fees for the child, but he has money to buy alcohol. And I mean, we are sort of given a platform through these educational programs where the women can present things to the men, that they may find it difficult to do by themselves in their families, but they're like when they're together as a team, then you will see the men watching them and sort of being quiet, like they get the point, as they are, and also about family planning, they have these, they have played a very key role in spreading awareness about family planning. So to have like a sort of grassroots network of women who have the confidence already of their own sisters, I think it has been a very important part of the model.
Great presentation. Thank you very much, Dada.
Thank you for listening.
Yeah, thank you for the question, Didi. It's good. It's really interesting to dig into the details of the problems and the motivations there. Does anyone else have a question they'd like to ask? Please go ahead and open your microphone or type it into the chat and I can read it out.
Okay.
I guess I'm curious because you said that one of the first steps was that you went into the government statistics, you kind of set a baseline of the some of these things like maternal deaths and like some of these really like the main metrics that you could have a look at. Has there been a kind of, and then at one of the slides at the end there, you laid down all the thousands of births that have happened, all these things. Has there been like a system of reports so you can kind of measure the projects of some of the progress of some of these key metrics or any kind of formal progress keeping like that?
Yes, yes, we have a lot of reports. I mean, we have an M&E department who collect all the data and analyze it all the time. And we know that we also have access to the government statistics and like our functionality, both when it comes to like the patronage of women giving birth in these health centers compared to other government health centers, and also like in the emergency obstetric services. Uh, uh, Everywhere we work in every local government, we are number one. Like where we have worked are the most. We have the highest numbers, and so the people are aware of that, and so we can see the progress throughout the years. I see someone Aradhana was raising the hand, flashing across the screen here. I saw.
I believe it was a clap. I think it was a cartoon applause to your.
What?
I believe it was a clap symbol for
The claps. Okay. Okay.
I second that emphatic applause. There we are.
Okay. I see.
One of the things that I think that you have done so excellently, Dada, is to reach beyond our own community and relate to other people. And I think that could be a whole proud space itself, because I think that that's the biggest challenge we have as an organization is that we've got such a strong community that we're not very good at reaching out beyond it. And you've done that in your work, and I have lots of thoughts about that because I know that you work with a whole group of people that are not Margis, who you chose to work with in Nigeria. Unless that's changed, but how do you connect with all of them? How can you? I mean, I'm sure it's partially listening, it's respect, it's many things, but it's a really important thing for us to learn as proutists.
Yeah, I couldn't agree more. I think that what I try to emphasize when talking about the health is like how practical it is. There's not much theory here or not much ideas. There's not much philosophy. It's just, and I think that if as proutists, when we sort of go down to the grassroots and we sort of challenge ourselves to get involved with the community, then I think we have every opportunity to learn things very, to learn a lot and be in touch with many people. So I think that as long as we remain in the area of just discussing the sort of theoretical aspects, sort of academic aspects, the world, our ideas, when we come down to the world, come down to the grassroots, when we're on the ground, trying to see how to apply it, it's only then that we will really be compelled to really work with, real people and, real experiences.
I think that would be Ranadira and other people here who work with ProutSpace. It would be really interesting to have a panel at some point where we have people who have really stepped out beyond the Proud or Ananda market community and reached out to the community and talk about how they did it and what what guidelines have really guided them in that process. So take that up as a separate topic at some point.
Yeah, I think that's a really valuable suggestion. One that comes to mind is Dharma or Dimitar Rusafov, who's over in Haiti. The kind of, you watch this progression where you go in with a team of people who are kind of, insiders, and then gradually step back as the local people take over. And it's really incredible, really incredible.
And Ananda Utama, who was here a little bit earlier before she had to leave, is also a person who has worked in a much bigger community that's beyond the market or PROUT.
That's a wonderful suggestion. I would very much enjoy a panel discussion like this. I would definitely pitch it to the team.
Okay.
Okay, we're drawing up to the hour and a half now. I'd just like to remind everyone that every session we ask for your feedback. Didi, you could put that in the feedback form if you'd like to as well. That would be useful, so we have that in there. I've put that in the chat, just so we can keep making the sessions as engaging and meaningful and interesting for everyone. And if there are no other final questions or thoughts, I just want to thank you, Dada, again. Thank you so much for sharing this work. I hope everyone got as much inspiration out of it as I did. Yeah, really, really fantastic stuff. And thank you everyone for joining.
Thank you so much. Thank you for everyone for listening. Thank you. Thank you, Ranadev. Thank you. Namaskar.
Thank you. Namaskar.